When you hear the word heart blocks, what is your first reaction? Is it, oh crap? Do you feel like your heart is starting to race? Do you feel if you were hooked up to a monitor, this is what would be showing? If that's the case, you are not alone. Studies have shown that 88% of nurses have a difficult time identifying first degree heart blocks on an EKG monitor. But it's not just a nursing issue. This happens throughout all of healthcare, from paramedics to physicians. Missing even a simple heart block can lead to dire consequences. But don't worry, I have a simple way to break things down so that you finally can understand heart blocks. Stay tuned for more. Hello, everyone. I am Dr. Richey, also known as Dr. R for short. I am a nurse educator and I am passionate on helping medical professionals understand complex information and materials, such as interpreting EKGs. Before we dive into heart blocks, I just want to give a huge shout out to Eric, who is the CEO of DART Simulations. The monitor you see that I'm using here is actually a software design that Eric created and came up with. Now, I have been using this particular setup in software since 2022. I use this to teach students ACLS and PALS. And then today I'm going to be using it to educate all of you when it comes to heart blocks. Anyway, thank you, Eric, for making this product so that I can educate nurses, paramedics, sometimes physicians, and now a greater audience who are going to be medical professionals on YouTube. Okay, now let's get into what we're going to be discussing today, which is going to be our heart blocks. All right, so to start with, I'm going to go ahead and kind of pause this. The first thing I want you to look at is a normal sinus rhythm. If we take a look, we have our P wave, we have our Q, R, S, and T wave through here, and it goes the whole way through. If we were to measure everything, it would all be within normal limits. Our heart rate is within normal limits between 60 and 100 beats per minute. I am not going to go through how to measure everything. I'm not even going to go through what is going to be the normal measurements. If that's something you would like, please put it in the comments below and I will create a video on that just for you. All right. So now that we know what a normal sinus rhythm looks like, let's take a look at this one. Okay, just want to make sure that I had enough up here. So for the time being, we're going to pretend that the monitor is correct because it's always correct, right? Okay, so right now our monitor is telling us our heart rate is 48 beats per minute. We're going to go through. We have a P wave. We have a Q, R, S, and T wave for every single P wave that we have. Since we have a P wave, that is telling us that this has something to do with the SA node that is working. So it's going to tell us that this is a sinus rhythm. In this case, a sinus dysrhythm. If we were to measure our PRI or our PR interval, we're going to find out that these are longer than the normal one. This is your clue right here that this is a first degree heart block. Again, we're going to have a P wave for every QRST complex. When we measure everything out, it will be within normal limits except for our PRI. And it's that simple. Now you know what a first degree heart block looks like. So I want you to see the difference. Normal PRI. Anything that is less than 0.20 seconds is normal. If we were to measure these ones out, I can tell you just by looking at this and guessing, which we never guess, we're going to print out the strip, we're going to measure everything. I would guess this is probably between 0.26, maybe 0.28, somewhere around there, compared to right here, which again is going to be less than 0.20 seconds. And that's how you tell the difference between a first degree heart block. So what's taking place with the heart? Why do we have this delay? Well, what's taking place is the SA node is doing what it's supposed to be doing, and it's firing. It's sending the signal down to the AV node. Typically, what happens with a normal sinus, it sends the message and it goes directly down to the AV node. In the case of first degree heart block, what's taking place is it sends the message, but as it's going down the track, it decides, I want to take the scenic route a little bit, and it's going to take just a little bit longer to get to the AV node to fire. Typically, a first degree heart block is benign. Typically. If you have a patient that was a normal sinus and then all of a sudden shows up as being a first degree heart block, obviously the first thing we're going to do is go check our patient. Okay. We want to make sure that they're asymptomatic. If they're showing signs and symptoms, then we're going to have to treat that. If they're showing no signs and symptoms, closely monitor them. This in itself, most likely, again, is not going to affect the patient. But this is an indication that a more lethal rhythm could be coming shortly, especially if this is new. What are some common reasons why someone would be in first degree heart block? I would love for you to put the comments down below on different conditions, medications that can cause a first degree heart block. I will tell you that if we have someone that's a patient of ours and they are extremely active, they work out all the time cardiovascularly, so they're runners, things of that nature, maybe they're swimmers, this could be normal for them. That's it. Also, have any of you had a dysrhythmia strip of a first degree heart block? If so, please leave a comment. Please let me know what your patient's presentation was, if they were asymptomatic, and especially if they're symptomatic. Please put that in the comments so everybody can learn. Okay, if you found this video helpful, please remember to subscribe, like, and share this video with others so we can get the information out there to someone else who could desperately use this information and also help save other people's lives. All right, keep looking for video number 2 with the heart blocks, when we're going to start diving into second degree type 1 heart block and second degree type 2. also known as Mobitz 1 and Winky block, and Mobitz 2, no Winky block.